ನಮಸ್ಕಾರ ಸರ್, ಚೆನ್ನಾಗಿದ್ದೀರಾ?
Namaskara, come. You're still having some asymmetry, huh?
Yeah, this side there's a nice measure, but here I feel it's bone.
The plate that is. This looks nice. Smile. Relax. Just loading your scan. Open your mouth. Okay, that is good. Bite. No, normally. Yeah, this is because of the plate which is there, that's all.
Okay.
So I show you the scan. I just check your scan, I'll show you the scan. If you remove that plate, that will become straight. That's all. I'll show you. This side you don't have to do anything because it's already in nice shape. And when are you going to finish your braces?
It's been 1 month since I started.
Okay.
So it might take many. I'm not sure like how much time.
How long did they tell you?
They told around 1 year.
1 year. Did they plan extraction or removal of a tooth?
Still they haven't said.
See, we have a good orthodontist here. Have a consultation with her today. Because if I feel, because on the scan, I'll show you, but they are the best judge for that. Let you take her opinion. Because if you do it quickly, it's better not to wait too long. And the bone is soft. I'll show you that.
Like
This
it's
side.
been 1 month. Like I have appointment on this Saturday, coming Saturday.
No, but we have done in January now.
Yeah.
So already so many months over. 5 months it should have
I
started.
visited them, but they said like let it heal properly, then we'll start.
Where are you getting this done in Bangalore?
Not in Bangalore, in Tiptur only.
Tiptur only you're getting done.
Yeah.
See, this is the thing. This plate is what is causing the slight issues for you. If you want me to remove this, we can remove it in 1 day, or you can remember that this needs to be removed in the future. But that's the only solution for that. If you remove it, it will be fine. We can
Other than that, there's no other issue.
nothing. How's your sensation?
Yeah, this side I feel like some muscle pulling this side off on this side of my face.
Smile nicely. That's going symmetrical. Okay.
When I smile, like it's symmetrical, but when I close my mouth here, this part,
It's just because the teeth also.
yeah. So it seems like it is shifted towards the left.
Now the hull treatment full complete agli. Because ಇಲ್ಲಿ ನೋಡಿದ್ರೆ ಇದು ನಾವು ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ ಮುಂಚೆ ಇದು ಮುಂಚೆ ಬಂದಿದೆ, ರೊಟೇಷನ್ ಆಗಿದೆ. ಅವಾಗ ರೊಟೇಷನ್ ಆದ್ಮೇಲೆ ಈ ಹಲ್ಲು ನಾವು ಈ ತರ ರಿಟ್ರಾಕ್ಟ್ ಮಾಡ್ತೀವಿ, ಆವಾಗ ಇದು ಫಿನಿಶ್ ಆಗ್ತದೆ. ಅಂಡ್ ಎಲ್ಲ ಆದ್ಮೇಲೆ ಇಲ್ಲಿ ಸ್ವಲ್ಪ ಸಮ್ಟೈಮ್ಸ್ ಇದ್ರೆ ಇದು ತೆಗಿವಾಗ ಅಲ್ಲಿ ಮಾಡ್ಬಿಡ್ತೀನಿ. ಇದು ಫುಲ್ ಕಂಪ್ಲೀಟ್ ಆಗುವಾಗ ಇದು ಇನ್ನೂ ಕ್ಲಿಯರ್ ಆಗಿ ಗೊತ್ತಾಗ್ತದೆ ಇಲ್ಲಿ ಸ್ವಲ್ಪ ಇದೆಯಾ ಇಲ್ವಾ ಅಂತ. ಸೊ ವೇಟ್ ಮಾಡೋಣ.
Yeah, here I can feel that
there is a maybe ಇಲ್ಲಿ ಸ್ವಲ್ಪ sometimes ಬರ್ಬೋದು ಒಂದು 2-3 millimeters ಬಂದ್ರೆ ಇದು ತೆಗಿವಾಗ ಇದೇ ಟೈಮ್ ನಾನು ಮಾಡ್ಬಿಡ್ತೀನಿ. ಒಂದು ದಿವಸ ಮಾತ್ರ ಆಗ್ತದೆ ಅದು. ಈ ತರ ಇಷ್ಟು ಥಿಂಗ್ಸ್ ಆಗೋದಿಲ್ಲ, ಇಷ್ಟು ಮಂತ್ಸ್ ಆಗೋದಿಲ್ಲ. ಬಟ್ ಇಫ್ ಕಾನ್ಸಂಟ್ರೇಟ್ ಆನ್ ಯುವರ್ ಡೆಂಟಲ್ now quickly, so you can take a opinion from my orthodontist here also. If you can wait for some time. Going back what time?
7:50.
Perfect. So evening she'll come. Have a look, at least a consultation to see how is it going on well. She'll tell you the plan, what all teeth has to be removed if required. Coordinate with your orthodontist there so we can finish this fast. ಅದು ಹಲ್ ಮಾಡುವಾಗ ಹೋಗ್ತದೆ ಫುಲ್. ಮಾಡಿ ಸಿ ಇಲ್ಲಿ ಪ್ರೀಮೋಲರ್ಸ್ ಇದೊಂದು ತೆಗಿಬೇಕು ಮೋಸ್ಟ್ಲಿ, ಅದು ಆ ಡಾಕ್ಟರ್ ಹೇಳ್ತಾರೆ. ತೆಗಿದುವಾಗ ಹಲ್ಲು ಪೊಸಿಷನ್ ರಿಟ್ರಾಕ್ಟ್ ಆಗ್ತದೆ. ನಾವು ಇದು ರೊಟೇಟ್ ಮಾಡಿದೇವಿಲ್ಲ, ಅದು ಇಲ್ಲ ಇಲ್ಲಿ ರಿಟ್ರಾಕ್ಟ್ ಮಾಡಬೇಕು. ಆವಾಗ ಲಿಪ್ಸ್ ಚೆನ್ನಾಗಿ ಕ್ಲೋಸ್ ಆಗ್ತದೆ, ಇದು ಕ್ಲೋಸ್ ಆಗ್ತದೆ. ಆದ ನಂತರ ಇಲ್ಲಿ ಸ್ವಲ್ಪ ಬೆಂಡ್ ಇದ್ರೆ ನಾನು ಸೆಂಡ್ ಮಾಡಿ ಕೊಡ್ತೀನಿ. ಇದು ತೆಗಿವಾಗ ಈ ಸೇಮ್ ಮಾಡುವ. ಸೊ ಒಂದು 6 months ಆರ್ 9 months ಹೋಗ್ಲಿ. ಅದಕ್ಕೂ ಬಿಫೋರ್ ದ್ಯಾಟ್ ಅವ್ರು ಕಂಪ್ಲೀಟ್ ಮಾಡಿಸ್ಬೋದು. And next January we are in Bangalore. So that time you can come and see.
ಓಪನ್ ಮಾಡ್ತಿರೋ ಸರ್
January 15th ಒಳಗಡೆ ಇರ್ತೀವಿ ಬ್ಯಾಂಗ್ಳೂರಲ್ಲಿ. So that time ಅದು ಮುಂಚೆ if it's finished ಬೇಕಾದ್ರೆ one day ನಲ್ಲಿ ನೀವು ಬರ್ಬೋದು weekend. ಅದಕ್ಕೆ we can send you. It doesn't cost also much. Very easy. ಆಯ್ತಾ? Welcome.
ಏನು ಪ್ರಾಬ್ಲಮ್ ಏನಿಲ್ಲ
ಏನೂ ಇಲ್ಲ ಪ್ರಾಬ್ಲಮ್ ಚೆನ್ನಾಗಿದೆ.